investigated by our public health team. There have been now 810 people pass away in Victoria as a result of this global pandemic. That is one further fatality since yesterday's report. A woman in her 80s linked to an aged care outbreak. We of course send our condolences to all families who've lost a loved one at the hands of this pandemic. There are 21 Victorians in hospital, none in ICU. A total of 2,840,686 tests have been received. Those test results have been received since the beginning of the year. That's an increase of 12,925 since yesterday. We are just shy of 100,000 tests for the week, which is an amazing effort, and I want to thank each and every one of that almost an MCG's worth of Victorians who've come forward to get a test. There is arguably nothing more important than a symptomatic Victorian going as soon as they register those symptoms to get tested, wait the 24 hours to get your test results, and if you are positive, then we can have that more complete picture of how much virus is out there, put a public health response around you to protect you and your family, and indeed every family. So we are deeply grateful to almost 100,000 people over the course of this week that have gone and got tested, and their results have come back to us. We've just got to keep those numbers up. We've got to keep coming forward as soon as we have any symptoms whatsoever. There are 18 healthcare workers who are active cases. The rolling average to 10 October is Metro 9.3, Regional Victoria 0.4. Cases, mystery cases, unknown acquisition cases for the 14-day period to 8 October is Metro 10, none in Regional Victoria. The regional metro split, there are 5 active cases in regional Victoria, and they are all in Mitchell Shire. The number of active cases connected to aged care, there are 34 active cases, so again those numbers continue to fall, which is very important. And the total amount of shifts that have been worked from hospital staff in private sector aged care is now up to 4,866 shifts, and we thank all of those healthcare workers for the amazing work they're doing in a sector that they don't belong to, in a sector that they perhaps never thought they'd be working in, but they have risen to that challenge, and I'm very proud of them and very grateful to them. Now, just a couple of announcements before I ask Martin and then Brett to add to my comments. It's very important as we get to these very low numbers, and people across Victoria will have seen that we've moved from not just cases and close contacts, but a public health treatment for contacts of those close contacts. So extending that ring or casting the net a little wider to make sure that anybody who might be infected because of either a casual or an actual period of contact are quarantined and are safe, both themselves, but also safe from giving the virus to anybody else. Further to that, I've got another announcement to make today that from 11:59 p.m. on the 11th of October, a person who's been deemed a close contact by the Department of Health and Human Services must get tested for coronavirus on day 11 of their quarantine period. That testing is not mandatory as such, but if a person chooses not to take that coronavirus test on day 11 to establish that they are virus-free at that point, then their quarantine, their mandatory quarantine period, will be extended by a further 10 days. This is just an abundance of caution to make sure that we've got the most complete data, the most complete picture, and that if we're saying to someone, okay, you've done that time that you had to be away from others, this is just double checking, triple checking that you haven't in fact still got the virus, as you then go about, particularly if you're in, say, regional Victoria, moving about the community with a very different set of rules to metropolitan Melbourne. I am very pleased to be able to report, though, that all of the data, all the evidence suggests that a very, very high percentage of people are doing the right thing, and I'm very grateful to them. But this is just about giving us an even more complete picture at the back end of that period where people are isolating. Beyond further, I should say, regional Victorian businesses have been doing a fantastic job in recent weeks as they've opened up. They're not fully open or back to normal just yet. There'll be further steps that we'll have to take, and I'll come to those in a moment. But it's really important that we have a strong partnership between our public health officials, WorkSafe officials, authorised officers, all of those people who are out there checking to make sure that COVID safe planning is being done and also adhered to. One important part about this is making sure that people from metropolitan Melbourne are only in regional Victoria for lawful purposes. Victoria Police obviously have the key role there in terms of roadblocks and checks, but there is also an important requirement that if you travel from metropolitan Melbourne into regional Victoria with a lawful reason, for a lawful purpose, the restrictions that apply to you in Melbourne travel with you. So, for instance, you could get a takeaway coffee, but you could not sit in a cafe or a restaurant, a pub, a bar. That's just not an option for you because you're coming from a community with a higher amount of virus, a much greater amount of virus than regional Victoria. And in order to protect those very low numbers in regional Victoria, which is should be, I'm sure it is, a point of pride for everybody living in regional Victoria. Regional Victorians have done such an amazing job. We've got to make sure that those rules follow someone, only those who should be in regional Victoria, but the rules have to follow them as a secondary defence, if you like. Now, it is important, and from, again on the same timeline, 11:59 PM October 11, businesses in regional Victoria will be required to take all reasonable steps to determine where a person is from before they are seated, for instance. This will have different applications in different settings, but there is a fine, there is a penalty of nearly $10,000, which is the standard business penalty for not complying with other parts of the COVID safe plan. But this is all about trying to make sure that people who are going into regional Victoria, yes, with a lawful purpose, but making sure that they are taking the rules and restrictions from the higher virus community, metropolitan Melbourne, into a lower virus community, regional Victoria, follow them. That is all about keeping people safe. And look, and I'm very confident that we're not going to have to be issuing any of those fines. I think that regional businesses that are open want to stay open. They don't want outbreaks. They are keeping meticulous records. They're working very closely with us, and we're very, very grateful for that. But it is just about taking it that next step, and they have to take those reasonable steps to determine whether the customer is in fact from regional Victoria, and if the customer cannot satisfy the shop owner, the business, that they are from regional Victoria, then the default position will be that the rules apply to them, the Melbourne rules. So you can't be seated. You could have takeaway, but you can't come into the premise and stay, just as one common sense example. If there's a need, I'm sure there will be, for us to provide further information, some case studies, some clarity to any business in regional Victoria, of course we will do that. But it is an important step. The other way around this, of course, is just to make sure that if you are travelling into regional Victoria, you only go for a lawful reason. If you are found to be attempting to travel into regional Victoria without a lawful reason, then the fine is just under $5,000. And Victoria Police sadly have issued a number of those. The other thing as well, if you're going into regional Victoria and you are entitled to be there, then you yourself have to understand that it's simply unacceptable for you to be doing anything that might spread the virus in regional Victoria, and therefore the rules travel with you. That avoids many more cases in regional Victoria, and that's obviously the strategy that we are attempting to deliver. The final announcement in terms of things I need to go to is in fact that I've just signed paperwork to extend the state of emergency and the state of disaster from tonight to 11:59 PM 8 November. That is simply to make sure that we've got that legal framework in place in order to continue to have rules to drive these numbers down even further. That's simply a 4-week extension. No one should read anything more into that in terms of it being key dates for shifts in rules and things. We try to do these things in 4-week blocks. That's the most appropriate way to go. This comes from detailed public health advice, and there will be a time when we do not need to extend these things, and I look forward to that day. I just wanted to make a couple of general comments about where we find ourselves. There will be, because of the hard work and the absolute determination of particularly Melburnians, but all Victorians, There will be steps that will be able to be taken next Sunday. They will not be as big a steps as we had perhaps hoped, but they will be significant. And they will allow us to move more freely. They will allow us to connect more easily with those that we love the most, those that we miss the most. I can't go through a full list of all of those changes because those decisions have not been made. But I would hope that with a sense of confidence, Victorians can look at these numbers and see, yes, this second wave is stubborn. It is absolutely stubborn. But at the same time, the magnificent job that Victorians have done and are doing means that we will be able to take some significant steps this coming weekend. They won't necessarily be as broad, as fast, as far as we had hoped to go, but on Sunday we hope to be able to have more to say, not just about what will come into effect very soon thereafter, but also to paint a picture of what the weeks after that look like. All of this, however, is predicated on data. It has to be based on how the virus is presenting and the sorts of numbers that we're seeing and the types of cases. That's the other thing as well, if I can just, in general terms, finish on this point. It is, yes, absolutely a function of how many cases there are, how much virus is there, but we just have to keep making the point, when it gets down to these very low numbers, the narrative that sits behind those numbers, the stories that sit behind each of those cases, they become increasingly important. They've always been important, but they become even more important when you're making these very fine and balanced judgments with a very small margin for error about what you can open when and do so safely. So I would simply say to every single Victorian, you have done an amazing job, you're doing an amazing job, we're very, very close to taking some significant steps. They'll be safe steps, and on that basis it won't necessarily be everything that we had hoped to do this coming Sunday, but it will be significant, and it will certainly allow people to better connect with the people that they love the most and that they miss the most. That's a really important thing. If I could give you a complete and detailed list of all the changes that we will likely make on Sunday, I would, but that would not be fair, and it would not be a reflection of decisions that have been made. There'll be a time for that. That will be next Sunday. And Brett and Martin and myself and many others will spend some more time this weekend and time throughout the week settling those matters. Victorians have done an amazing job. We are so close to finding that COVID normal, and we've just got to find it in ourselves and support each other to just put in these last few weeks so that we can see this thing off, open and stay open. Get the numbers low and then keep them low. That's the strategy. The strategy is working, but this is a stubborn thing, and it will sit there smouldering, waiting for us to relent, waiting for us to prove not equal to this challenge, to let our frustrations get the better of us. And it's at that point that we will see this virus run again, and all the good work that we've done won't count for very much. We are very close, and it's all down to you. It's all down to the work that you have done. We've just got to see this thing through for a few more weeks, and then we can find that normal and draw a line under 2020 and look forward with a real sense of optimism towards a very different 2021. Now, just one final matter. As I've indicated previously, and consistent with the fact that I established the Independent Board of Inquiry into quarantine matters and other matters, the board has sought additional information from me and my senior staff, text messages, telephone records. As I had indicated, as I had committed, all of that detail will be handed to the board. It'll be done as soon as possible. I can't give you an exact timeline because Telstra and others have to provide us with those details, but that will be provided just as they've asked, just as I indicated we would if such a request was made. All of us want answers. All of us are entitled to answers. It's an independent process. I can only speak me and my senior staff, including media staff. They will all be handing over the relevant details. I can't speak for any other requests that the board has made of anybody else. If they have, then the Board of Inquiry would be best placed to be able to answer any questions you have. Beyond that, I don't think I have anything else to go through, so what I might do is now ask Martin to speak to those couple of announcements, particularly regional metro travel and obligations on businesses, who I again stress have done an amazing job, and we're very grateful to them. This is not a criticism, it's just about trying to bolster each and every line of defence against this virus. to keep numbers in regional Victoria very low. And Martin might also speak about day 11 testing. Brett can then talk about the numbers of the day, and then we're all happy to take any questions you have.
Thank you, Premier. And today, as the Premier's indicated, we're announcing how we want to give our public health teams the tools they need to make sure that our careful and cautious move back to a COVID-safe reopening happens. And the two aspects I want to focus on were firstly, the 11-day close contact testing issues. So as we all know, if you are identified as a close contact for a positive case, you are required to go straight home and to isolate and quarantine for the required period of time, 14 days. And at the 11th day, overwhelmingly, we've seen people cooperate in the testing that is part of that system. And I want to thank all of those people who have been part of that system. As of today, we will be making sure that the obligation is pretty clear, that if you are identified as a close contact, that you will be asked to test at day 11. And should you choose not to test at day 11, you will be required to continue your quarantining for a further 10 days. That's the period of which we can be absolutely sure that the incubation period has seen its way off. I stress that that is a very, very small number of people, because what we want to make sure as we deal with the stubborn tail of the second wave is that we give our public health teams the 1%ers they need to drive this infection rate away. And this is one of the tools that we think will just help in the very small number of cases that our public health teams need for that regard. And that will be in as of tonight. In regards to, as the Premier's indicated, the arrangements for people who take their obligations as permitted workers from Melbourne into regional Victoria, we want to make sure, as we've seen in some recent cases, that those businesses in regional Victoria are given the tools they need to work in cooperation with our public health teams to make sure that they stay COVID open and COVID safe. And as we've seen, for instance, in Kilmore, the amazing work that Oddfellows Cafe did in making sure that they could so quickly and so accurately share their data with the public health teams to make sure that that ring of connections was put around that set of contacts. But we also want to make sure that those businesses are given a positive incentive to say to those people who come into their businesses from, if the very small number who might come in from as permitted workers from Melbourne, that they bring their obligations as permitted workers to that business. You are not allowed in those circumstances beyond your takeaway or whatever it is, obligations for a very brief period of time. And of course, the fine also applies to those individuals, approximately a $5,000 fine to those individuals who don't act appropriately if they are permitted workers from Melbourne in regional Victoria. So these combined measures are just those few extra tools as we get closer to a COVID-safe COVID reopening to make sure that our public health teams, our businesses, and the overwhelming majority of Victorians who support this strategy are given the efforts and the bricks they need to build that wall for a COVID-safe reopening. These 1%ers count, particularly as we get towards the end of this stubborn second wave. We're nearly there, and we will get there, and we will have a COVID-safe summer in the very near future. I'll ask Professor Sutton to talk to the figures of the day.
Thanks, Minister. Today you'll see that we've said there are 10 cases under investigation and 2 that are linked. In fact, I'm aware that Two of our new cases are additional cases linked to the Box Hill Hospital outbreak, one additional case in a patient and one in a household contact of a known case. And there is one new case linked to the Chadstone Shopping Centre outbreak, which brings that total to 33. I'm also aware of a couple of family outbreaks, so I know people can get concerned about the 10 that are still regarded as under investigation. In a sense they are. We're trying to work out the origin of these family outbreaks, but there is one family outbreak in the western suburbs consisting of 5 cases. I don't have further details, and another one consisting of 3 individuals across 2 households. So in fact there are 8 of those remaining 10 cases that we have some details on. They are, as you would expect, isolating at home, but with further investigations as to the source of those outbreaks. Now, I did say yesterday that we had challenges with respect to time to test and time to isolate. Please don't take that as saying that individuals are doing the wrong thing. I'm not talking about blaming individuals. I'm talking about systemic behavioural challenges for everyone in Victoria. And we all need to support that. It's not just about the individual. There are challenges that are part and parcel of the way our society operates, and the obligations are not just for that individual, they're for everyone who is trying to support those behaviours. So time to testing and time to isolation, I've called out because they are really critical elements and they do make a difference. The robustness of the response to individual cases is only as strong as all of those pieces coming together. If somebody is symptomatic for 3 days before they test, it doesn't matter how quickly that case gets notified, and following them up, there are still 3 days of exposure, potentially to family members, potentially to other people. So I only highlight it because it's a really critical behaviour for all of us to address, for government, for the friends and family of those symptomatic individuals. If you are talking to someone over Zoom or on the phone and they have a new cough, tell them to test. If someone is in your family and you know that they have a sore throat, they've got a new runny nose, they've got a fever, tell them to test. If they are finding excuses not to test, support them to do so. And if they are not isolating, tell them that there are supports available to anyone who tests positive to have accommodation to support them in their isolation. Away from their own family, yes, that's tough, but they'll be supported with a place to stay, food, and as we've indicated previously, a $1,500 payment if there isn't otherwise payments available through their workplace. They're really important elements because this is how the virus transmits, and it takes advantage of the time that others are exposed. The additional challenge is obviously the system response, but we are wrapping every single case with a public health response that is really, in my opinion, robust. We're standing up incident management teams sometimes for a single case because it has complexities, and we're absolutely standing up an incident management team if the risk assessment for a cluster is that it requires all of those elements, the mobile testing teams, the pop-up clinics, the community engagement that is required to get on top of those, and we do. We've got no new cases in the family outbreaks in Frankston. We've got no new cases in Kilmore. We get on top of these, we're getting on top of them quickly, but there are genuine behavioural challenges that are not about blaming individuals, they're about challenges for all of us, and we have a collective responsibility to play in getting on top of them. Thank you.
So I'll just add to Professor Sutton's comments. We can't change the fact that some people, last week or the week before, or 2 or 3 months ago, were symptomatic for days before they got tested. What we all can do, though, is we can focus on, if you have got symptoms today, even mild symptoms, please don't wait till tomorrow to get tested. Please go and get tested today. The quicker everybody reacts and responds to those very mild symptoms, the less virus we will have, because we've cut off, we've basically eliminated, shut down so many different opportunities for the virus to be spread to others. It's very simple. The sooner you go and get tested, as soon as after having recognised you've got some symptoms, the less virus we'll have. I know that sounds a little bit counterintuitive, because usually the more you look, the more you find. But this is not about so much finding cases, it's about stopping spread, and you can only do that if you first find the cases, because people have gone and got tested very soon after they have realised and had a sense that they have symptoms. It's a simple message, and it's not about trying to change what can't be changed. It's about just calling upon people to be really acutely aware and to act.
Premier, on the Board of Inquiry's request for your phone records, is that from the start of the pandemic or over a select period of time?
I think they've indicated the day in question, the 27th. Whatever they've asked for, they'll get. So they'll get.
Just for the day, or is it like for a short period of time?
I've not actually seen the letter. It's come to me via my staff. I think it was received either last night, early part of the evening last night. I've not seen the letter, but what I can confirm for you is each and every record they've sought, they'll get.
Can we just clarify whether that includes messages on apps, including WhatsApp and other messaging services?
I would assume so.
Or is it just phone text?
No, I'm not sure whether they've broadened it out that far, but in the spirit of the request, then they would receive any and all.
And how many staff will that cover? You said senior staff and media staff. How many people?
I'm not sure. It'll be a significant number. I might just make the point that I don't know that any of my senior staff would ever have spoken to Graham Ashton, because it would not be appropriate for them to speak to Graham Ashton. There are always channels to be gone through, but for completeness sake and out of an absolute determination to provide the inquiry with whatever it is they need and want, all those senior staff, including media staff, myself, I assume that the same requests may have been made of others, but I'm not in a position to. It's not really appropriate that I should know who else the inquiry might have asked for things from, but the inquiry would probably be able to confirm that for you.
When you say others, I assume you're referring to ministers?
Well, it could be other ministers, could be other public servants. Could be public servants.
Within your senior staff?
No, he's not. Doesn't. No. Mr. Eccles is not a member of my private office. He's the head of the public service. He may have received a similar request. I don't know. I think those questions would best be answered by the Board of Inquiry themselves.
Just to clarify, back on Alex's point, even if the letter doesn't make explicit for you or your senior staff to hand over, messages on Signal or other encrypted apps, you will be handing over those?
Yeah, I don't think there's any issue with that at all. Mr. Ashton has indicated that he received a phone call, but from an abundance of caution, we're happy to look at text and whatever other messages, regardless of carrier or service. I would have thought. I didn't contact him. He didn't contact me. He indicated that someone did contact him. He can't remember who. As for his phone records of incoming calls, as we had quite a debate and exchange the other day about this, I obviously can't provide that information, neither can he. But there are ways in which that information can be provided, but that's ultimately a matter for the board as to whether they see that as something that they need to do.
Have you ever offered prior to this to hand over your records of messages and phone calls? And if not, why not?
Well, no, that's not the way that it works. The inquiry makes requests of information. Otherwise, it'd be hard to know. You would literally be handing over not 300,000 pages, but literally millions of documents.
The date of March 27 has been in the spotlight in the inquiry for weeks now. At some point,
well, no,
you
it's
must
not.
have known it would have been of interest.
Well, that's a matter for Laurel. That's a matter for the board.
Fully with the inquiry. What's stopping you from saying, "Hey guys, do you want my phone records?"
Well, no, hang on. No, we're not. I'm not having a suggestion that we've not cooperated fully. We've absolutely cooperated fully. I've made it very clear. Whatever you need, ask, and you'll get it. That's what we've done all the way through. So they've now made a request, and we will deliver against that request, and we will provide any and all details, information that we can, and that's a perfectly appropriate way to go. And if they make another request next week or the week after, well, which I don't know whether that's likely or unlikely, probably not that likely, I wouldn't think, given that they're writing their report and they've already done a fair bit of work, but they've made a request and we will deliver against that. No problem at all. That's exactly why you set up the inquiry.
Just on Sunday, even if we get
this coming Sunday.
This coming Sunday.
Yep.
Even if we get zero cases, if we get 0 cases, we will reach the trigger point of 5.
Yes.
Below 5, but you're saying that we will still have.
No, I think it's highly again, yesterday I tried to be as clear as I could with people that did not look likely to me or to any of the team that we will get below 5 by next Sunday. It's mathematically possible, and it'll probably be mathematically impossible after we get more than no cases tomorrow. However, we'll be guided by those numbers as they unfold throughout the week. It's just about trying to give people a little bit of notice that I don't think we're going to be able to go as far and as fast as we'd hoped, but there will be significant changes. They won't be as much as we had hoped to do, but it's not like next Sunday will be the same rules that this Sunday is being conducted under. We will have more to say, but frustratingly, I know for everybody, I'm not in a position to detail what they'll be. The day for that will be, in fact, Sunday.
Does this mean that we're essentially moving away from the trigger point plan that was flagged several weeks ago?
No, I don't think so. I think that, as you see, I'll try and put it this way. I think all the way along we've said we'd use common sense, and of course these targets are very important because they are a representation of the risks that can be attached to any decisions you make. But at the same time, I think we've been at pains to make the point that the stories behind these cases are just as important as the numbers, particularly when the numbers get very, very low. And I know a lot of people would be at home watching a listing and think, well, if we can't open at 10, but we could open at 5. I know that's a very frustrating thing, but mystery cases and volume of cases is absolutely central to whether you can open safely with a degree of confidence that the numbers would stay low. We will have more to say on Sunday, and hopefully we'll be able to speak not just about what changes from probably midnight that night or maybe Monday, but also a little bit of a sense of what we think the next couple of weeks look like also. So we're not moving away from those targets. I suppose things do change though, because we've got more data, there's less assumptions, there's more actual data, and we're seeing the way this is running. And look, to be really frank, I'm very pleased to see that the low numbers in regional Victoria have stayed low. That is a credit to people following the rules. I think if you'd asked me a couple of weeks ago, would we see some more cases in regional Victoria, I might well have said that we might have had more than 5 active cases. But testing numbers are solid, the numbers are low, and they're staying low. We all have to be vigilant though. Doesn't mean it's over. Doesn't mean that the rules don't matter. So I think there'll be some room to move to a, if I can call it better and worse, a better set of rules in regional Victoria and a better set of rules in metropolitan Melbourne, but it won't be that full third step. I think that's most unlikely. And I just didn't want to have a situation where, we're bowled up next Sunday and everybody thought we were just going to take that step when it seems pretty clear we're not going to be able to do that. But we will be able to do some significant things.
Will the 5K limit be lifted?
Well, the way to answer it, Alex, it's a perfectly legitimate question, because it does absolutely limit the amount of movement, and it's there for the best of reasons, and it's had a really direct and a very important impact. Frustratingly again, I can't necessarily attribute an exact percentage of benefit to that one measure because it is aggregate, but that's on the table, and I don't want to do a big laundry list, but just to give you a sense, that's on the table, of course, because everything's on the table. A whole lot of outdoor activity is on the table, and we'll also spend quite a bit of time thinking about what's a safe group size for people outside to be able to come to be able to join each other and to be part of the thing that we crave the most, and that's some of the connections that we've been deprived. We have had to go without for such a long period of time. I know I don't want that little list I just gave you to then see 100 questions, because I can't answer those. But that's where we're headed, and they're the things we'll look at really, really carefully. So when I say it'll be significant, I think it will be, because it'll be the stuff that people are really, really missing. The other thing too is that there are some outdoor industries, there are some outdoor workers. We'll be looking very closely at all of those issues too. But I don't not give you the list because I've got it and I don't want you to know. We haven't settled it, and when we do settle it, we'll be here to announce it and to try and explain it as best we possibly can.
Will there be something for business? What you've talked about seems to be more about social interaction, which is great, but will obviously businesses are
I think Melbourne will be more in that vein. I think regional Victoria, there are some opportunities, but again, it's not about giving people a sense of false hope. It'll be in, or setting people, running to think that something's going to happen that just isn't. It'll be consistent with the rules that are there now in regional Victoria, but there may be some more things we can do. But that's all got to be worked through. I don't make these comments to do anything else other than, I think, be straight with people and try and give people a sense of what's coming. But I can't give you a definitive list, and I'm sorry, I can't answer yes and no's on a whole lot of stuff. But I think that it will be safe for us to take some, what you've termed, Laurel, some social steps in metropolitan Melbourne on Sunday. The exact nature of those will determine throughout the week, and indeed right up until Saturday night. But in regional Victoria, if your question's about economic versus social, I think there'll be more economic things that can happen in regional Victoria because the numbers are low. Does that mean we're doubling, tripling, quadrupling the number of people that can go to a pub? No. But if we can take some further small and safe steps, we will. And we're in constant communication with lots of different industries about that.
On the issue of testing.
Go Lundy and then Simone.
Given we've seen how these things can get away from us in healthcare settings, are you testing enough people at Box Hill Hospital? Should there be broader asymptomatic testing of staff there just to try to nip this in the bud?
I believe we've got a pretty aggressive testing protocol in all of our health services, and no one's averse to doing more in that space. In fact, Jerome and myself, and Martin may even have been here as well, I think, made some announcements last week. I won't give you a date because I wouldn't want to be held to it. I think it was a week ago or so, about testing in high-risk workplaces. So whether it be meat works, hospital, aged care, the list goes on, and wanting to test a quarter of staff. That's not whether they've got symptoms. They shouldn't be at work if they've got symptoms. So that'll be, by its very nature, asymptomatic testing. I'm happy to come back to you, though, on exactly what's happening at Box Hill, unless Brett knows any more than that.
I did say yesterday that they were following the outbreak standards that are the national standards. I did check in with them, and I provided my view that I think there shouldn't be a 30-minute cut-off for people getting tested in terms of the amount of time spent on the ward. So I think that testing can and should be open to, and I think it is being open to anyone who spent any time on the affected ward. So that does apply to asymptomatic staff, and I think the case for very broad testing again with the end game of coronavirus in Victoria, there's a good reason to test within our testing capacity, which is very substantial, and we've got room to move in that.
So is that, as of today, staff who spent any time on that ward will be able to get
That's
tested?
my understanding, yeah.
What is our testing capacity at the moment?
Look, really, we could test 30,000 people in a day if that were required. So I'm not concerned about any of our testing capacity. There are obviously sometimes logistic challenges getting out to a particular location, but even that is working really quickly, as we've seen in Kilmore, as we saw in responses in Colac and elsewhere. So no concerns about testing capacity, and that turnaround time is brilliant. So a lot on the same day. If you test in the morning, you'll get that result in the afternoon, and 96-97% within 24 hours.
With the Kilmore case, we waited, they waited almost a week, or maybe I think it was just a week, for the Victorian Government to say, okay, if you've visited Kilmore Cafe, the Oddfellows Cafe, go and get tested regardless of whether you have symptoms or don't. Given our case numbers are so low and we're trying to contain clusters and outbreaks at the moment, and we have testing capacity, would it not be more appropriate to say, right on the very first day, this is an exposure site, you've visited the facility, go get tested regardless of whether you have symptoms or
We
not?
are moving to that, absolutely. So casual contacts in settings, exposure sites, are being prompted to get tested as casual contacts, not just as close contacts who meet that 15-minute face-to-face or 2 hours in a room definition. So that's a change that's occurred.
When has that occurred?
This week, essentially. Yeah.
With the Box Hill cluster as well, that also took a couple of days for you to come out and say, regardless of how long you've spent in that ward, go get tested, whether it's 3 minutes or 30 minutes.
Yeah.
are you aggressive enough in, advocating that message or putting out the message for people, go get tested regardless of symptoms or not, if you've been to an exposure site?
I want that threshold to be low. I want us to do really aggressive testing. So I'll be checking in with the Outbreak team and landing all of those protocols going forward. But I think that's the view of our case contact and outbreak management team, that we should be as aggressive as we can, again within that testing capacity, and within reason about what the prospects of finding a case are. There's the counter, which is if you test really widely in a population who are at very low risk, then you get false positives, and you end up taking actions that are not necessary and can be very disruptive. But even false negatives are pretty rare in our system. But with tens of thousands of tests being done every day, they do crop up, and they do have consequences as you isolate people or as you shut down businesses or other settings. So we have to have that in mind as well.
And just on that, I know you've sort of moved away from the disproportionate language, but earlier in the week, both you and Dr. Alan Cheng had said testing everyone would be disproportionate. I guess you either test, trace, isolate, and have infection prevention control measures in high-risk settings and do that really, really well and err on the side of caution, or you risk a third wave and a lockdown. So the two are just not comparable. So I guess, will it be a feature of the pandemic in your response to positive cases and clusters moving forward?
Yeah,
we
will.
On the side of extreme caution when it comes
indeed,
to that.
What we regard as proportionate at the end game is different to how it might have been with 700 cases a day. So we have to have a really low threshold for testing. We have to be really aggressive about it. These additional obligations for people to test on day 11 as close contacts might not have been seen as proportionate 2 months ago. I think it is now. And again, we're probably not going to have any additional cases that we find by virtue of that additional obligation, because the great majority of people were testing at day 11 anyway. But you just want every single layer there to capture any potential cases as you possibly can.
There is a primary school in Elwood that there's a message circulating on Facebook that a child has tested positive and that they won't be able to open. Are you aware of that case?
I'm not aware of that. It might be hot off the press from the Outbreak team this morning, but I'm not aware of it at the moment.
Given we've been between 10 and 15 cases for more than 3 weeks now, is there a chance we will never get to 5? We will never get to the targets that we'd set to move to the next step, that we might just have to live between 10 and 15 cases a day?
Who knows? No one's been to this point with a second wave anywhere in the world. We are treading new ground. So I won't say in absolute terms what the possibilities are. We can't discount that it might be extraordinarily difficult to drive down to zero, but I think it's possible, because I know that with no international travel that doesn't require quarantine in Australia, then you've got a cohort of individuals and chains of transmission that are in Victoria at the moment, where there are tried and true public health measures that can get on top of them. The things that need to be in place are isolating immediately, are quarantining immediately, are testing as soon as you've got symptoms, and then wrapping that public health response around each and every case and each and every cluster. If those things work, we will get there. But who knows in absolute terms if all of those things can fall into place. We're unequivocally focused on that. We're putting every ounce of our energy into it. But as we've always said, this is a collective effort. It requires those individuals to heed that message and to take it absolutely seriously, because the COVID normal summer that we're talking about relies on that. But also everyone around those individuals, everyone in the broader community, to amplify those messages about the things that we must do to get there. Mask wearing, hand hygiene, not going to work when unwell, getting tested straight away, they are all critical things to be in place. And then for government to do the work of that messaging, our behavioural insights unit to understand what the barriers are to people being motivated to do those things, to the best ways to channel those messages so that people understand them and respond to them. all of that needs to fall into place. But can I give an absolute guarantee that that's going to happen? No one could. And no one else in the world has gotten to a point in a second wave where it's been driven down to a dozen cases a day. But if we're the first in the world to get to a point where we can completely snuff out a second wave, then no one will be happier than me.
But at what point do you say, well, we're just not getting there quick enough and all of Melbourne is in lockdown, let's just open up a little bit anyway?
Well, we are opening up a little bit. We will always make those judgments about what opening up we can do with the caseload that we have. But for those who advocate let it run, it's really not that dangerous, let's protect the vulnerable and let everyone else get on with their lives, they don't understand that we've already been to that. That was easing through our first wave, and the aged care sector was overwhelmed with cases, and we had over 600 deaths associated with that. So we have to bear that in mind. We can't go to a place where we've got 1,000 cases a day, and the 725 cases that we peaked at was with a very robust response in terms of the restrictions that were in place. So you can imagine what it might be like if we would have a really free movement of people with that number of cases. So we have to have those balanced decisions all of the time, and we'll review each and every moment, but I think it's absolutely the right focus to have at the moment to get to a point where we've got zero community transmission or such low transmission that it is absolutely sustainable into the long term.
For months now. Oh, sorry.
So I understand the need to extend the state of emergency. What's the rationale behind extending the state of disaster? We obviously didn't have a state of disaster back when we had this number of cases earlier in the year. Why do we need a state of disaster?
Simply, Lundy, it's to put beyond any doubt each of the measures that we have in place. It does provide the government with a whole range of powers. They're used wisely. They're not used unless they need to be. It's just from a abundance of caution, if you like, to have the best set of arrangements in place for a 4-week period. Those arrangements will not be in place any longer than they need to be, and the powers, either under emergency or the state of disaster, only get used where they're absolutely needed. I do look forward to the time when we don't have to have either of those frameworks in place. I think disaster will come off before the state of emergency does, given that the state of emergency underpins all of the public health rules, if you like, all the public health directions that are made under the Public Health and Wellbeing Act as well. So there's a crossover there. It's no, as I said when I did it off the top, I wouldn't read anything into that date, and I wouldn't read anything into the fact that it's been extended, other than to say we're not at a point where we don't need that. We will get there.
Specifically to the state of disaster, previously when we've asked the difference between, this is not necessarily from you but from media staff, we've said, well, why do we need a state of disaster and a state of emergency? Sure. They specifically pointed to the curfew and said that's the measure that the state of disaster was needed. So can you now, you said it gives you a range more powers, but are there any restrictions
and
that
some,
allude actually?
Let me come back to this, so I'll give you a completely accurate answer. But it's not just what's there now, it's also, it does give you some powers that you can use if you need to in the future. There's no limit on that though. I could just as easily not have done it, but just from an abundance of caution and do them together, have them lined up so that they're operating on the same 4-week. We moved to that some time ago now to have them operating on the same timeline, the same window. We will use those powers and that legal structure for as long as we need to, but the time will come when we won't, and that'll be a mark of the success of the Victorian people and all of their hard work.
We've spoken about bushfire preparation and people
Yes.
leaving Melbourne to go and prepare their homes in regional Victoria for the bushfire season. Now we've got parts of southwest Victoria that are flood affected. Have you got anything more to say about people leaving Metro Melbourne?
Not today, but I know and appreciate that it is a very important issue, and we'll have more to say, I believe, this week about that, so that people can have the certainty to know what they can do, what's lawful. We'll have some further advice for them. This is a complicated pre-fire season period as well, as you allude to, with floods and the Bureau forecasting very significant rain events right throughout the coming weeks. So that has a real impact, I think, as well, in terms of the sort of work you do and whether you might need to go back and do it for a second time. Given that the spring, from a growing point of view, I think is going to be longer than it otherwise would. There's even predictions, and again, again, we're not going to get too far ahead of ourselves, but the Bureau tell us that this looks to be a wet summer or wetter summer than last. So we just have to wait and see how that unfolds.
From us, Professor. Yes, no, that's fine.
Just for months now, you've used the language that we must stay the course. You've extended certain lockdowns because we haven't met targets that we've created. But now you're moving ahead of the plan that you made people wait weeks to learn. Can you just tell us a little bit more about why are we now suddenly seeing a very different approach where we're easing restrictions not based on staying the course or
No, I wouldn't draw that conclusion at all. Frankly, I don't think I really don't see that. No one else has put that construction to me. That's fair enough. You're entitled to do that, but I don't see it that way at all. It's all data driven. It's all safe steps. So, for instance, we're not doing, because it's at 10, say, Alex, rather than 5, and maybe it'll be less than 10 by the time we get to Sunday. And I do hope you're right in terms of zeros all week and we get to 5. I think that unlikely. That data will still drive us, and that's why it's not going to be the entire step 3 that we had talked about. It will be elements of that, and again, based on rigorous analysis, the science of it, the data, the narrative that sits behind cases as well. They'll only be things that are safe, and that means they'll be limited. They'll be significant at a very personal level, but they will be limited because to go further would be unsafe. So what guides us in all those steps hasn't changed. I suppose what is potentially
what essentially a step 3.0.
Yeah,
are
so
we
that,
now moving?
yeah. So what it is, that was exactly the point I was about to make. I think you're absolutely right to say, maybe it's a 3A or it's a 3- and a 3+ for regional Victoria, that type of thing. So it's about breaking a series of larger steps into perhaps some smaller ones that you can do. And I suppose I would flip the construction around and say, well, the alternative would be, look, we think it might be safe to do these 3 or 4 things, but let's not do that. Let's wait another till we get to 5. I think where you can do more, you always should, provided it's safe. And they're the really fine judgments that have to be made.
Is this an appreciation that there is less willingness among the community because we're kind of reaching the end? There is less compliance, and people are basically indicating that they're not going to stay in under the restrictions that we currently are willingly.
No, I'd make 2 points. No, I don't think that's the case, because we still see compliance at a very, very high level, and we're deeply grateful for people doing the right thing. And that, I think, is an absolute recognition at a very personal level that we've come so far, we've given so much, there's been so much pain, it has to be worth something. We've got to finish it off. We have to finish this job off. But the second point, I think, I fully acknowledge that people are getting very weary. They're getting very fatigued. They're getting frustrated. We all are. We all want this to be over. But all of us deep down know, I think, that we can't pretend it's over just because we want it to be. I think we all know that. And even those who, for months, and have been calling for every restriction to be taken off, I think deep down they know that what that would mean, and it wouldn't mean anything good. So where you can take safer steps, you should. I acknowledge that there's a lot of pain out there and people are really feeling it, and that's the nature of these things. This is we're well into the last quarter and people's legs are tired. The game is very tight, and you've just got to dig deep and find, all of us, and find a way to get to that final siren. That is what we have to do, and I'm really confident we will. That isn't to say that there isn't great need out there and great pain, and that's why we're working to support people as much as we possibly can, and that's why the budget, when it's delivered, will be unprecedented in the level of investment to underpin confidence, to repair damage, but also to make sure that 2021 is very, very different.
Can I ask Professor Sutton just
You certainly can. No more for me?
Can I ask one more for you?
Sure.
Just on the
You
changes.
could ask after Professor Sutton as well. That isn't an issue, but yes, go.
Sorry.
That's right.
Just on the changes for next week, given what you've said about social changes, should hospitality and outdoor dining maybe not get their hopes up?
Those matters are not settled yet, but I think in broad terms, and I'm just again, look, it would have been easier for me just to stonewall and not give you any answers to any of these questions. I don't think that's fair. But at the same time, if we can kind of If we can try and acknowledge that I've given you and the Victorian community a sense of things, but there are some things that I legitimately just can't answer, and I don't want everybody who wasn't talked about when I went through the themes, if you like, of what Sunday will look like to be particularly concerned that they're not in our thoughts and in our planning and in the very detailed decision making that we do. What I said is I think it's probably more in the social space in Melbourne. There can be some economic changes in regional Victoria. They'll be small steps, they'll be safe, but they'll be meaningful. And the other thing I'm hoping to be able to do, and this goes directly to your question, hopefully, by Sunday we're able to give metropolitan Melbourne, particularly from a business point of view, a little bit more clarity about what the weeks ahead look like, a week, 2 weeks, 3 weeks after next Sunday. But again, I have to add, as I have all the way through, that anything we said about the future will all be based on case numbers, mystery cases, types of cases, all of those things. But as much certainty and as much clarity as we can provide, we've always tried to do that, and I think to the best of our ability we have. I'm just giving you a bit of a sense of what the themes for next Sunday will look like, because I don't want people to be completely despondent about these things. These numbers are coming down. We're not at 725 cases, but it's stubborn. It's absolutely stubborn, and none of us should be surprised. This thing it's not easily beaten. It's not easily beaten. Brett.
Just wanted to ask along the same theme as well. Given we've still had clusters that have grown to considerable sizes, I think it's like 33 in Chadstone at the moment, Box Hill, other family clusters. How comfortable are you with easing some restrictions on Sunday? We also have a number of mystery cases as well, and we haven't been able to reach that threshold.
Yeah, I think the things that we ease we'll do with a degree of comfort. We wouldn't be going there unless there was some confidence that they're the things that can change within the risks that we know are still out there. The mystery cases that continue to pop up, the clusters that can grow very rapidly. We have to have that in mind, and the changes that will be made will have that in mind, absolutely. But it does point to the fact that you really need to understand where transmission is occurring and how, to understand how that risk equation changes with any easing of restrictions that come into play.
And what does the last night's narrative about our data reveal?
The narrative?
The last fortnight, sorry. What's the narrative behind the fortnight?
Look, I think the general trend in aged care, in healthcare settings, continues to be positive. The number of residents who've become newly infected in aged care has dropped off very substantially. That's a great thing. There are still a number of active outbreaks in aged care, mostly related to staff cases that continue rather than resident cases. So that's a real positive in that space, and I think it relates to the fact that the support to management, the support to outbreak control and all the prevention measures can be much more intense when there's a much smaller number, and everything that's been worked through with the Victorian Aged Care Response Centre to coordinate and collaborate around that. The number of active healthcare workers in acute care, as you know, continues to come down below 20, and that's a positive. What we've seen in the last couple of weeks is that the community cases between workplaces and households has again risen up. Really, we were at just a couple of cases per day outside of the healthcare worker or aged care cases. It's now up to 5 or 6. So we need to get on top of those clusters and those outbreaks. They're the real key things, and that's why I would reinforce again those elements about isolating immediately with symptoms and getting tested straight away.
I wanted to pick up an earlier point that you made regarding the messaging. People getting the messaging and government focusing on that. Public health, as you know, is predicated on 100% of the population not being able to follow rules, either because they're unable to or they're unwilling to. Moving forward, other than the testing of close contacts on day 11 or just the aggressive casual contact testing, what else would you recommend the government to do in order to be able to contain outbreaks into the future?
I think we're always working on those messages. You'll see some in the weeks ahead, if not days ahead. But it relates to those pillars of response again. So testing we really want to reinforce, and again, the vast majority of people doing the right thing, able to do the right thing, wanting to do the right thing. Others have challenges that are systemic challenges in some regards. There are a very small number of individuals who just don't care. We need to reach all of them with all of those elements coming together.
I meant, what else are you sort of advising the government, or other things that you're working on regarding government policy to be able to contain outbreaks other than the messaging?
Oh, look, I don't think there's anything new in that space. All of the things around the next circle of contacts, the sewage testing and surveillance, other mechanisms of surveillance that we're working on that flag respiratory cases across Victoria that might be an indication of coronavirus, that we can actually check in and see if people have tested. The strengthening of surveillance, the strengthening and coordination of the incident management response and wrapping everything around it, they're in place now. There's not anything new in the public health response in that regard, but it's making sure that they are all those elements, surveillance and response and prevention, are at the top of their game.
So do you think has the government exhausted all of its options on being able to contain outbreaks?
No, I'd never say that. I think we're always in a process of feedback. What are the new challenges? What are the possibilities in terms of responding? Sewage surveillance is a case in point. It's rolled out to new locations, and for regional Victoria it'll be really critical because again, it'll get to a point where there are no active cases, and if sewage surveillance pings in a new location, it can be positive after there are active cases for some weeks afterwards, up to 7 weeks, that people can continue to shed the virus and it's detected in sewage. But we will get to a point where all sewage surveillance across regional Victoria is negative on a routine basis. If we see it become positive, there'll be a really rapid and robust response in terms of asking people to come forward for testing, as has happened in Apollo Bay and Anglesea. So that'll be one of those things. So, I would say we are always looking to new ways that we might be able to respond, but at the moment it's really consolidating and strengthening all of those key elements.
On that point, is there still coronavirus in those areas?
Yes, I believe that we're still seeing through sewage surveillance some positive samples that shouldn't concern us. We've had recent active cases there. They'll continue to shed the virus. The sewage surveillance is a very sensitive mechanism, so it does pick it up. But when we know that there's been a period of time and no active cases, we shouldn't expect the sewage surveillance to remain positive.
Can more be done to prevent staff working across, for example, COVID and non-COVID wards, and to make sure we've heard about that a bit in the second wave?
Yeah, the healthcare worker task force, healthcare worker wellbeing task force that has been focused on infection prevention in particular, has really looked at that policy of cohorting staff, and will look to strengthen that in the fullest way possible. That's being rolled out and should be in place across almost all acute healthcare settings. So I think that's a key element that we'll continue to make sure is in place. There are some non-clinical staff that we need to ensure are also cohorted to the fullest extent possible. That's more of a challenge because they, cleaning staff, other support staff can work across wards, but we need to roll them into the testing for surveillance purposes. We need to roll them into the cohorting as well, so that they're not potentially working across areas when infectious.
Do you know when that's likely to happen?
Oh, we're working on it continuously. The cohorting for clinical staff is in place. We are working on the implementation for all staff.
So staff
now
shouldn't be working across wards now if they're clinical staff?
That's right. Again, to the extent that it's feasible, and it's not necessarily saying one staff member per ward, but it is cohorting to the extent that is feasible, so that there isn't just a free movement across all clinical areas.
Can I ask about fit testing too? Why aren't or I guess when will all of the COVID wards be doing that?
Yeah, again, not really my area. Safer Care Victoria lead this work, and the healthcare worker task force have brought in the respiratory protection program. Fit checking, which is a simpler mechanism just to be assured that the N95 masks sit well on the face and don't feel like they're incorrectly fitting. That's important. That's being done across the board. But fit testing requires some specific skill sets in those who do it, and is a more complicated procedure. I know that they're looking to roll that out extensively, but it's not something that can reach the tens of thousands of clinical staff immediately. But it's probably a question for Professor Andrew Wilson, and maybe we can get some lines from him in response.
We've been in the pandemic for over 6 months now, and healthcare workers have been calling for N95 masks and pit testing right from the very beginning. Why has it taken so long?
Oh, look, again, it's probably one for Prof Wilson to respond to. I think the key elements in protecting healthcare workers are not about a single intervention. They're about a whole bunch of critical elements that need to be brought into the system, including patient flow and the flow of staff and the ventilation within wards and the spacing of COVID positive patients. The lessons from aged care about the sudden surge of admissions into hospital was a key issue. They're all elements that need to be addressed. N95 masks have been available, but fit testing is a particular challenge, and I would defer to Prof Wilson to respond to that in full, I think.
How alarmed are you about the Box Hill outbreak?
Oh, we never want to see healthcare workers infected. We know that as long as there are people who are looking after patients who are potentially positive, that there's a risk there. We need to use all of those elements that I just referenced to minimise that risk to the fullest extent possible. And that does include PPE, and it does include fit testing to add that additional level. But all of those things need to be in play. And that doesn't bring the risk down to zero. It brings it down very, very substantially. But those risks will still occur. There are still aerosol generating procedures, aerosol generating behaviours that we're aware of, the shouting and talking that can sometimes bring virus into the atmosphere. So it's not an easy thing to address if you haven't identified a patient potentially. It's much easier when you know that there's a positive case and all of the things that you need to have in place to look after someone. But there'll be some patients who aren't identified immediately as coronavirus patients. There's a really good surveillance process through the emergency department for suspected COVID patients, how they're managed. But it's a continuing challenge.
Should it be sorry?
Well, just wondering, in Box Hill, do you go, hang on, something might have gone wrong here? Are you having a look at it, and have you identified any problems in the system that might have led to this outbreak?
Yeah, again, for Safer Care Victoria, but they do look into each and every one of those incidents, and they looked to a root cause analysis to try and get lessons about what might have occurred. It's not always clear who the index case is. Sometimes they're unidentified. Sometimes there might have been a patient who's come through who hasn't been picked up as the index case, or it might be a visitor. So it's not always easy to have those final determinations, but the root cause analysis process and the investigation of those outbreaks are present routinely.
Should there be a higher assumption in those situations where you suspect that there might be a COVID case? Should you just say, well, it could be a COVID case, so we'll just increase the measures to be sure?
Yeah, that happens. So suspected COVID cases are managed with a particular set of measures to minimise that risk. We do know, though, that there are some individuals who are going to be infectious prior to being symptomatic. They might come into hospital for another reason that has, that might relate to symptoms that are not at all COVID symptoms. So it can be tricky in that sense. You can obviously go to hospital for reasons other than COVID, but you can still be in a infectious phase for it. But suspected COVID patients, I think, are being managed very well through the emergency departments or indeed outpatients or elective admissions.
Can I just ask about aged care?
Sorry, I was going to ask about aged care as well.
Okay. There's been concerns raised, particularly by Associate Professor Michael Murray, that the system still is not ready if there was to be another outbreak, another wave, that we'd have similar problems again in aged care. How confident are you that enough change has been made in the system, in the processes, so that we wouldn't have this appalling tragedy again?
Look, I think it's a challenge. The Victorian Aged Care Response Centre has done a power of work. They've been very collaborative. They've had so much investment in the not just the response and the coordination of that response, but in looking at the prevention measures in aged care as much as possible. But it's my personal view that there are systemic, intrinsic vulnerabilities that are still present in aged care. There's a Royal Commission into it for a reason. There are a number of challenges, and I think they're not easily solved overnight. And I think we will need to continue to work through the VACRC, but with everyone in the aged care sector to reduce those vulnerabilities as much as possible.
Do you think it's ready?
I think we need to continue to work on it. I don't think we should sit back on our hands with aged care. The vulnerability there is has played out with the deaths that we've seen, and we have to work continuously to make sure that that risk is mitigated to the fullest extent.
Just back to, and on October 2nd, you went into a little bit about the genomics within the hot hotels. Since then, have the investigations found anything, and also have we ruled out any contract tracing links between the hotels and external cases?
Not that I've seen. No, nothing new on that front.
But the investigations are done and finished, or not?
With respect to what?
All the cases from the hotel, positive cases for people working in hotel quarantine. All the contract
that
cases
we recently spoke to.
Yeah.
Yeah, as far as I know.
Yeah. Okay. Just on contract tracing again, my understanding is that early in the pandemic, aged care staff in facilities were relied on quite heavily in order to be used to contact close contacts. Was that the case, and how long did that occur for?
Look, it's still the case in as much as we need to have the details that only an aged care facility will have about who was on a shift on a particular day. So that's kind of true for any business. It's true for any setting that you need to know who was there and you need to know when they were there. So we rely on that, but we have outbreak squads that now go out on site immediately, and if they are useful in helping steward through that process to make sure that that's clarified immediately, then they're doing that.
How long were they you said that there's squads that go out, but how long were they relied on in order to do essentially the contact tracing?
They weren't doing the contact tracing, they were providing the information that our contact tracers were using to follow up with those everyone who's considered a close contact in aged care. But I'm not sure the exact date that the outbreak squads were in place.
On those two new family outbreaks, you mentioned there's one in the western suburbs.
They're both in the western suburbs, as I know. Yeah.
Do you know which suburbs?
No, I'm not absolutely sure on that. We can come back to you.
With the Chadstone cluster, have any asymptomatic people tested positive to COVID?
I don't know. I haven't heard that. It's not beyond possibility, and maybe it can be part of the show update in the afternoon.
Actually, mystery cases, how are we doing?
Mystery cases, so I know we're down to 10 at the moment, but there are some additional mystery cases that I have some details on, at least I hope so. Or I will have that in the update this afternoon. Oh no, two new mystery cases with postcodes that are now defined. So 3147, which is Ashburton and Ashwood. Again, that's a call out to people to come forward for testing immediately if they're symptomatic. That applies everywhere, but Ashburton and Ashwood to be a particular note. And 3037, that covers Sydenham, Taylor's Hill, Hillside, Delayey and Calder Park.
And can we have just one more question on the phone records, just so we dot all our I's and cross all our T's. In a technology world, a lot of people have a personal and a private phone for work matters. Will records from all of their devices be handed over?
I only have one phone. Others may have more than one phone, if that's what they choose. Phone records is what they're after. So what device they're on doesn't really matter.
Can I ask about aged care? How confident are you that the system now will not have the same repeats of the tragedies that we've seen?
Well, the question I think was asked a moment ago, are we ready? We are ready. Whether a sector that I don't regulate, I don't fund, I don't run, whether that sector is ready, then the only person who can answer that is the Federal Aged Care Minister. We are there to help. We are there to do whatever we can, and we will, because we absolutely have. But in terms of the compliance with PPE, the compliance with people working multiple shifts at multiple places, the compliance on cleanliness, on all of those issues, we only have a limited visibility on what occurs in those private aged care settings. Public health in Victoria has not taken over private aged care. We have not done that. And there's a Victorian Aged Care Response Centre, which is an aged care response centre. It's not it's Victorian in that it operates in the state of Victoria, but it's not run by the Victorian Government. I think there is significant work that has to be done here, and we are absolutely committed to doing that work. But as for a venue by venue, issue by issue tally for who's up to scratch and who isn't, I can't provide that to you. That is not something that I've got. That is something that only the federal government can speak to. Once they've got a sense of where any problems are and a well-defined plan to deal with those problems, we're more than happy to help. Absolutely more than happy to help. These people are Victorians after all. But I can't. We can't barge into a private aged care facility and pretend to be running it. We aren't running it. It is regulated by a different body. So I can't say to you that I'm 100% confident in all of those arrangements. I hope to get to that point. But it's really important that we're clear about this. People have to work together, and we are. But that doesn't mean that we assume all the responsibilities, and what I mean by that is we assume all the powers, or the authority would have been a better way for me to put it. We don't necessarily assume all the authority and all the functions of a different government. So I hope to be able to say quite soon that we have that degree of confidence, but I think there are some issues out there and they need to be worked through. And what I can offer is an absolute determination. We will do whatever is asked of us. We will do whatever is required to work with private providers, with the federal government, with whomever needs to be worked with. We will do that. I think we've demonstrated by the fact we've sent 5,000 shifts, more than that, isn't it? Almost 6,000 shifts. I think it's 5,000 shifts worth of workers from hospitals into a private aged care.
So what needs to be done? Have you?
I can't speak to that. I can't. The
You
way
have
I
that information about
the way So the way I'm interpreting your question, and the way I think of this issue, I cannot speak for every venue, every home, and every practice that goes on within them. I can do that for the couple of hundred aged care facilities that we run, but I can't do that. I cannot do that for the private sector. Only the Commonwealth Minister can speak to that. What I'm saying to you though, in order that we can all get to a place where we're all equally confident that we've done everything possible, then we need to know where the problems are, and then we need to know and be asked, if you like, to play a part in fixing those problems. But I think, I hope I'm being clear, the conversation needs to start with the people who run it, and then I'm more than happy. If they need things from us, we'll absolutely do it. That's what we have done. But these questions have got to go not just to us; they've got to go to the federal government as well, because it's not a point of criticism; it's just a point of fact. It's regulated, funded, and run not by our government.
Have state authorities asked for that information?
We're in constant discussions. There's been some.
The federal government is resisting?
No, I wouldn't say that. I would leave the federal government to answer those questions. I'm not going to try and answer them for them, and I'm not interested in having an argument. I'm just pointing out that there is one government who runs this sector, and then there is a government, our government, that's in charge of public health. We want to work together as much as we can, but I'm not going to stand here and look down the barrel of the camera and tell people that I've got 100% confidence. That's very difficult for me to have that, because we don't run it.
So
What I can tell you, I've got 100%.
concerned.
Well, what I've got 100% confidence in, if we are asked to do something, we will do it, and it will be done to the highest possible standard. But again, these questions and this discussion has got to include the Commonwealth Government. It can't just be a conversation with us. It has to be a conversation with the Commonwealth Government as well. That's the point I'm making, and I'm certain that the Federal Minister and the Prime Minister and others will be more than happy to engage in that. After all, this is a system that they run.
But if you are standing here saying you cannot have 100% faith that the aged care system...
I'm just being honest.
Okay, That must be a concern, though. That must be.
Well, I'm concerned.
deeply worrying.
I'm concerned with the wildly infectious nature of this virus and the fact that there will always be an inherent vulnerability in settings like this. And I'm concerned to make sure that we not only have a picture of where the problems are in every single venue, but we have a plan, and where we're asked to be part of that plan, we absolutely will be, to remedy any of those problems. I don't want underlying problems in private aged care to be holding us back from opening up. I don't want that. I also don't want underlying vulnerability in private aged care to cause any more deaths than it already has. I don't want that to happen. I want to make sure people are safe. But this conversation, it seems, it's had with us a lot, and that's fine. Always happy to answer questions, and we're happy to do whatever we're asked to do. And indeed, from time to time, we have our own ideas on what we should do, and we put those to the Commonwealth, and we get on and do them. But you can't have this discussion with just one government. It's got to be had with both. I don't regulate these people. I've no ability to say do this or your accreditation is gone. People don't make complaints. The complaints are not made to us. They're made to a federal agency. It means it's a complicated space, but I think we're equal to this. I think there's a genuine goodwill to get on and work together. But the conversation's got to be had with more than just our government. It's got to be held with the federal government and indeed many of those private businesses.
Do you think the federal government has failed elderly Victorians?
I wouldn't say that. I'm not interested in making those sorts of comments. I think that's very colourful and might read well, but that's not productive.
In terms of Mornington Peninsula, the latest
Yes.
push to make them permanently regional
Yes,
council.
I have heard this. I'm not proposing to change the borders of metropolitan Melbourne and regional Victoria. If
And-
that changes, then I'll announce it, but I'm not making those announcements.
And in terms of school tomorrow, lots of kiddies getting back. Do you have any
Which is
comments?
very good. I'm very pleased. I'm very pleased.
Just back on aged care,
And I might well be joined by the Minister for Education tomorrow, and he'll say that as well, I would think. It's good, and we thank our teachers and staff, we thank parents, students of course. They'll be very pleased to get back to face-to-face learning. It'll be staggered in some places. It won't not every student that's supposed to be coming back this week will necessarily come back tomorrow, but it's a really important step, and it's only made possible because people have given a lot. Parents have given a lot, students of course, and of course our teachers and staff have done an amazing job as well. But I would just say, sick kids cannot be sent to school. Not any day, in any year. But any child that is unwell cannot be sent to school tomorrow. The only thing for them, if their symptoms are in any way consistent with this virus, they need to get tested. And potentially other household members would need to get tested. That's something, just as a very polite reminder, you just cannot, any sniffle, sore throat, all those well-known and well-understood coronavirus or potential coronavirus symptoms, those kids and young adults cannot be sent to school tomorrow. They must stay home, just like no staff member can go to school in any industry, go to school or go to work in any industry if they've got even the mildest of symptoms. If there's no other matters, if there's nothing else I can help you with, I would just finish by saying, is that right? Or
You just want to clarify
That's fine, no worries, sure,
on what
sure.
Laurel said, because I know that it's not your area, but you did say, I think there are some issues out there.
Well,
I
they've
just
done.
wanted
The
to
federal
ask-
government have done an audit. The federal government have been and looked at different aged care facilities. I believe they've done all of those. You'd have to speak to them about the results of that audit. And I don't think it's the case that 100% of venues were 100% right. I think there are some issues there, and that's not surprising. As Professor Sutton just noted, we're having a Royal Commission into this industry for a very good reason. That's for others. That's for next year. I'm not focused on that. All I'm focused on is doing everything we're asked to do and more to keep people safe. But I just think we seem to have kind of moved past or not necessarily recognised that there are a couple of hundred aged care facilities that we run. The Victorian Government run them. But we don't accredit them. They're accredited by the Commonwealth Government. We are a provider. Even then, we don't run those places really. They are accredited by a different government. We just seem to have moved past or glossed over the fact that there's two governments involved in this, and we both have to work together. I think we are, but I can't speak to things I haven't got. I can't speak to the work that the federal minister does or the federal regulator does, because they don't work for me. They have their own job to do. I have concerns. But my main concern is to do everything we possibly can to keep people safe, not just now, but right throughout 2021. I'm just being as frank and as open as I can be. And if there are no other issues, please, if you've got any symptoms at all, don't put off the test till tomorrow or Tuesday. Please go and get tested today. That's how we stop the spread of this virus. Thanks a lot, and we'll see you tomorrow.